So can root canal treated teeth, can they get infected? If they get infected, how does the patient present, and what are the possible options for us to treat them is what that we look into this video. In specific, we had a patient coming into a clinic. He had got a previous root canal done many years back. He has also subsequently got crowns done on that particular tooth. But he was complaining that there was some weird feeling on his teeth, on one of the teeth, on the front teeth which the root canal has been done. And also when he was brushing and when he was trying to put his hand next to the root surface of that particular tooth, he was having pain and so he was a little concerned about what was happening. And so let's look into that particular issue of infection post root canal treatment and what can be done in this particular video. Hello, this is Dr. Arun from Dentistry, running a dental centers at Chennai, Raja, Namalippuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So typically root canals are a very successful process. So when this particular patient came, because he had an issue of pain on pressing that area of the tooth, so of course we took an x-ray, we took an intraoral x-ray, we took a full mouth x-ray also. So we will show that x-ray to you in this particular video for you to see that x-ray. So what we actually saw on that x-ray is there was an infection on one of the upper central incisors, the left upper central incisors to be precise. So that infection was causing bone loss there. So because of the bone loss, in the x-ray it shows as a black radiolucent spot there. That's how it showed in the x-ray. Also what had happened is it was slowly resolving the root of the tooth. So if you look at the size of the root when you compare the size of this particular tooth root to the adjacent tooth roots, this particular tooth root was much smaller in size. So it was very evident that there is an infection that is happening inside that particular tooth post root canal treatment, which is causing the bone to be lost and also the root to start getting resolved. So that's what was actually happening. So now when we have this issue or when we have this condition, we've got two choices. One choice is to see whether we need to extract the teeth, do an implant. That's one option. Second option, to see if we can stop the infection, stop the spread of infection and see whether we can save the tooth. So so this call is more of a clinical call and also taken a radiography call, like take a look at the CBCT, and then both we present these pictures, both clinical pictures and the CBCT pictures, to the patient, and collectively we take a call whether to save the tooth or not. So in this particular instances, when you look at the CBCT also, we saw that there was a lot of bone loss that is happening in that particular tooth. We will show that portion of the scan also that has been taken here. So now we choose to save the tooth for this particular patient because we thought that the adjacent tooth were root treated also, and he is wearing a crown that is all together, and we decided that let's save the tooth there because infection was still under control. So we do a procedure called an episectomy where we open the site of infection by a small keyhole, like a small keyhole surgery. We make a small incision, open the gum flap there, see that infection there, access the infection, completely clean that area. Once we completely clean that area, and we ensure that the tooth root end as well as the surrounding bone is completely debrided. Once we debride it, we put some graft there, we put a membrane, and then we close it. If you look at a post-operative X-ray, you will see that area, that black is no more there. It will be seen as a white filled area of bone graft that is there. So we'll be able to save the tooth. So this is a procedure which can be done to remove the infection of a previously root canal treated teeth. It can be a very predictable procedure provided we do a thorough treatment planning and a thorough selection of which will be the right tooth to save by doing this method. Hope you'll enjoy this video. If there is any questions, please do ask in the comment section below. Do like the video, share the video and subscribe to our channel. Until next time, this is Dr. Arun from Dentistry. Bye bye and thank you.